Okay, thank you everyone for coming to our monthly Lunch and Learn. So my name is Denise Ramatar, and I'm the Outreach Coordinator and Data Analyst for our agency. A little bit about the Office of the Healthcare Advocate. We're an independent state agency, and we offer free services to all consumers in Connecticut who have any issues with their health insurance. As long as your health insurance plan is delivered or issued in Connecticut. And our mission is actually to help all these consumers with any questions pertaining to their health insurance. We do have a staff of nurses, paralegals, attorneys, and other support staff that are here to assist you with any questions you may have. So today, because it is October and it's Breast Cancer Awareness Month, Caroline Butler, our nurse advocate, very intelligent nurse advocate, will be doing a presentation on screening versus diagnostic tests for breast cancer. If you have any questions, please wait till the ending of the presentation, or you can ask them in the chat. Okay, Caroline, take it away.
Thanks, Denise. Hi, I'm Caroline Butler, as Denise said. Just going to go over a quick overview about some different testing, screening versus diagnostic, and breast cancer, and the importance of making sure that you're having your annual preventative exams and follow-ups with your doctor as necessary. So I'm just going to start with some of the differences between screening and diagnostic tests for breast cancer. And the reason going over this is insurance related, because some of the insurance plans, they treat your amount that you owe different for screening versus diagnostic. So screening mammograms are annual preventative exams, while the doctor may order a diagnostic mammogram based on any signs of breast cancer or abnormalities. And then a diagnostic mammogram is a more detailed screening mammogram for women who are experiencing symptoms or to follow up on any abnormal screening that they may have seen in the preventative exam. Ultrasound is not typically used as routine screening for breast cancer. Ultrasound can be especially helpful in women with dense breast tissue, which could make it hard to see abnormal areas of the mammogram. It also can be used to get a better look at suspicious area that was seen on a mammogram. There's many resources that you can find on the American Cancer Society website related to this. I'm not going to read each, the whole entire insurance law, but there is Connecticut insurance laws based for breast screening in Connecticut. So Connecticut law requires certain health insurance policies to cover baseline mammograms for women aged 35 to 39, and then every year for women aged 40 and older. Policies must also cover comprehensive ultrasound for women's entire breast. If the mammogram shows heterogeneous or dense breast tissue on breast imaging reports, or any of the BI-RAD system established by the American College of Radiology. A woman is at increased breast cancer due to family history, her own history, genetic testing, and other indications determined by her provider. They also have to cover MRIs for women's breast, which is in accordance with the American Cancer Society guidelines. And so these are the current insurance laws. There was a big change in 2023, actually, which was in favor of patients covering more of the testing under the Connecticut insurance laws. And then we're going to go through like which plans are covered by Connecticut insurance law and which aren't. So state law applies to individual or group health insurance policies delivered, renewed, amended, or continued in Connecticut that cover basic hospital expenses, basic medical surgical expenses, major medical expenses, or hospital or medical services, including those provided under an HMO plan, or individual health insurance policies that provide a limited benefit to health coverage. And this is where state law does not apply to employer-sponsored self-funded plans, also called ERISA plans. So self-funded plans are if you work for a very large group and they are not going to follow under Connecticut state law. So an example would be like if you worked at Travelers Insurance or Hartford Hospital, those are self-funded plans and they don't have to follow Connecticut law. Any Medicare Advantage plans, Medicare plans also, and then plans written in other states. So if you live in Connecticut, but you work for an employer out of state, or your employer has their headquarters out of state, then Connecticut insurance law does not apply. And then this is just talking about the 2023 breast and ovarian cancer screening. So this was a new act for 2023 that began. And the act expand coverage requirements under certain commercial health insurance policies for specified procedures used to treat or prevent breast or ovarian cancer. It expanded health insurance covering requiring breast mammograms, ultrasounds, and MRIs. And it requires coverage of certain procedures related to breast cancer treatment, including breast biopsies, certain prophylactic mastectomies, breast reconstruction surgery, and subject to conditions. It also requires coverage for genetic testing, including a breast cancer gene of BRCA1 or breast cancer gene BRCA2 under certain circumstances. So this is, or any other of the routine ovarian cancer screenings, including surveillance for tests for certain insureds. The act prohibits the policies from imposing cost sharing, meaning co-insurance, co-payments, deductible, or other out-of-pocket expenses. So this is new for 2023. So this was a big win in the insurance world, especially for women who were getting charged very large amounts to have breast cancer screenings done. So the cost sharing prohibits applies to all affected policies, but it only applies to high deductible health plans to the extent federal law permits. So as long as it does not qualify a medical or health savings account from preferable tax treatment. Lastly, the Act makes minor changes, including adopted general neutral language, specifying that mammography, ultrasound, and other certain coverage requirements apply to any insured and not just women. The Act requirements apply to fully insured individual and group health insurance policies delivered. And there's more information on this, the current and new law that can be found on ct.gov website. And so these are the Connecticut breast cancer rates. So the statistics are very high in the state of Connecticut. They're actually quite alarming. And if you follow anything about breast cancer in Connecticut, and Department of Public Health releases a lot of statistics about it. But Connecticut has the second highest rate of breast cancer nationally throughout the United States. It's an unknown reason, but we are second in the entire U.S. Breast cancer is the most common cancer in Connecticut for women. The incidence rates are higher in Connecticut compared to the entire U.S. And then breast cancer is the second leading cause of cancer deaths in women. And then nationally, the statistic is a woman living in the United States has a 12.3% or 1 in 8 lifetime risk of being diagnosed with breast cancer. And in 1970s, the lifetime risk of being diagnosed was 1 in 11. So the rate of breast cancer has increased significantly. And so this is, how can OHA help? So, our office can help patients with either if they have a fully insured plan or a self-funded plan. If you feel that your insurance has denied something or hasn't covered something correctly, our office can help you either way. Assist with insurance denials for cancer screening, imaging, medications, chemotherapy, radiation treatment, or any denial. OHA can also help consumers understand their plans, what their plan covers, based on if it's self-funded or fully insured plan. OHA can assist with appeals for any breast or cancer-related denials. And if you're not familiar with our office, we also help with every sort of denial. This presentation is just based on the breast cancer awareness. So I thank everybody for joining us today. It was just a quick overview, a little bit about the Healthcare Advocate Office and the law and screenings. So I don't know if anybody has any questions, I'd be happy to answer.